Hey everyone, it's Dr. Hodges, and I want to talk a little bit about a success that I just had with one of my patients. And I know in the past I've discussed how important your gut biome is. And I always think it's funny, like, no pun intended, that I used to kind of poo poo the whole idea about probiotics. And oh my goodness, they make a huge, huge difference. So let me tell you this success story that I had with a patient. And literally the only thing that I did is put him on a good probiotic. He was on it for 2 months, and the symptoms that he's been having for greater than 10 years have resolved. So I had a patient that came to me that had previous bariatric surgery, but they'd also had several other surgeries in their abdomen. So he's had a lot of instrumentation, and a lot has been going on in his abdomen. He suffered from SIBO in the past. He also suffered from a bout of giardia, which is an amoeba infection greater than 10 years ago as well. And so he's been seen by numerous surgeons, different doctors. He's been treated for SIBO in the past. And typically, if I have a patient that comes to see me and they're having multiple BMs in a day, I will kind of go through, I want to make sure that there's nothing anatomic that might be contributing. So for instance, if somebody has a gastrogastro fistula, I want to make sure that their common channel is not too short. These are anatomic things that need to be addressed. However, I always try to do the easiest thing first. So if I have a patient that comes to me and if they're in the middle of a workup, which this particular patient had also been followed by GI, so they've also looked and made sure that there was no inflammatory bowel disease that could also be contributing to their chronic diarrhea. For this particular patient, we had them on pancreatic enzymes. They did not need an antibiotic for flagell or the antibiotic flagell to help. And then I also placed them on a really good probiotic. If I have a patient that's coming to me and they're having a lot of issues with constipation or just general GI malaise, one of the probiotics that I really like is from Bariatric Advantage. It's the Flora Vantage. Align is also good, but I really like the Flora Vantage by Bariatric Advantage. For my patients, though, that are coming to see me and they're actually having the issues with the opposite end of the spectrum, so they're having a lot of issues with diarrhea, I actually really like VSL3. Now, what I want you guys to know is that if you are having these issues, you must consult with your doctor. I don't want you to take anything that I'm saying as frank medical advice. So you will need to be followed by your own GI doctor, primary care doctor. If you've had previous bariatric surgery, you certainly need to be followed up by your bariatric surgeon. But I will tell you, this sweet little patient who's suffered from chronic diarrhea for almost a decade, we really worked to improve his gut biome. Started him on VSL3, and he now has regular bowel movements. Regular bowel movements, no more diarrhea. A lot of the reflux and vomiting and bloating has also resolved because we really focused on his gut health. So take that for what it is. If you are somebody that struggles with IBS, I strongly recommend that you discuss with your GI doctor or primary care physician the use of probiotics. Look into maybe using VSL3. I think also this video has not been sponsored by that particular product. It's just something that I use in my practice. If you want to find out more, you can always check out my website. I will have some of these products linked below. But I was really, really excited for my patient because now their symptoms are resolved, and it's from the use of a probiotic. So you don't have to suffer in silence. Or if you're Rudy Tootin' with loud noises. So probiotics really can play a huge role in your symptoms. So check them out.